Hey everyone, and welcome back. Today we're going to be doing a deep dive into person-centered therapy,
Yep.
PCT,
All right.
um, and we're going to be drawing from some insights from counseling professor Russ Curtis, Ph.D.
Okay.
And he's got a couple of YouTube videos that really kind of unpack this approach, and it's a humanistic approach.
Right.
And what we're hoping to do today is get to the core of how PCT actually works in practice.
Yeah.
And maybe uncover some of the reasons why it might be trickier than it seems at first glance.
Yeah, you hit the nail on the head with that deceptively simple thing.
Yeah.
One of the first things that really grabbed me about PCT was this idea that we all have this built-in drive to grow, to self-actualize.
Yeah.
And, Curtis uses this really nice analogy of a tree stretching towards sunlight.
Yeah, I love that analogy.
It's so evocative.
That one really stuck with me too. It makes me wonder, is this drive something that we can actively control and direct? Or is PCT more about, clearing a path for that growth to happen organically?
That's a really good question. And I think it gets to the heart of how PCT is different from other approaches.
Okay.
It's not about providing a roadmap or a set of instructions.
Right.
It's about creating the optimal conditions for that natural growth to unfold.
Gotcha.
And a huge part of that, as you might guess, is the therapeutic relationship itself.
The therapeutic relationship.
Yeah,
Curtis actually says, first we accept ourselves, then we change.
right.
And that made me think about how many times I've tried to force change in my life without first acknowledging and accepting where I actually was.
Yeah.
Like putting the cart before the horse,
Putting the cart before the horse. I think we've all been there.
Yeah.
There's this pressure both internally and from society at large to fix ourselves, to
Yeah.
constantly strive for improvement.
Yeah.
But PCT suggests that true, lasting change is actually rooted in self-acceptance.
Okay, so we've got this foundation of self-acceptance, but how does that actually play out, I guess, in the therapy room?
So the therapeutic relationship in PCT is characterized by a few key elements. First, there's unconditional positive regard,
Mm-hmm.
which basically means accepting the client without judgment, regardless of their past or their current situation.
Yeah.
Then there's empathy,
Okay.
really putting yourself in the client's shoes and understanding their unique perspective. And finally, there's congruence,
Okay. Congruence.
which means the therapist is being genuine and authentic in their interactions with the client.
Congruence is an interesting one.
Yeah.
It makes me wonder how a therapist balances, being authentic with maintaining those professional boundaries.
That is a really important nuance.
Yeah.
And it kind of highlights the skill involved in being a PCT therapist.
Yeah.
It's not about completely blurring boundaries or oversharing personal information,
Right.
but rather being real and present in the relationship, modeling healthy self-expression.
Yeah, I guess it comes down to using your own experience in a way that benefits the client and not the other way around.
Exactly. And it brings us back to your earlier question about, whether we can actively control our growth. So while PCT emphasizes the client's inherent drive, the therapist's role is to create a space where that drive can flourish.
Yeah.
They're not directing the growth,
Right.
but they're providing the support and the optimal conditions necessary for it to happen.
So it's sort of like being a gardener.
Exactly.
You're not forcing the plant to grow, but you're providing the right soil,
Right.
sunlight, and water.
100%. And just like a gardener might prune away dead leaves or support a plant with stakes,
Right.
a PCT therapist might gently challenge those limiting beliefs or help the client develop healthier coping mechanisms.
Right.
But the emphasis is always on nurturing the client's own capacity for growth and change.
Okay, so we've got this powerful relationship as a foundation.
Right.
But what about actual techniques?
Yeah.
So Curtis mentions things like active listening, reflecting feelings, and immediacy.
Right.
Can you unpack those a little bit more?
Sure. So active listening in PCT is about truly hearing and understanding what the client is communicating both verbally and non-verbally. It's about being fully present and attentive without interrupting or imposing your own interpretations.
I think that's something we could all benefit from, not just in therapy, but in all of our relationships, right?
Absolutely.
Really being present and trying to understand where someone else is coming from.
100%. It's a foundational skill for any meaningful connection.
Right.
And then there's reflection of feelings, which involves accurately identifying and mirroring back the client's emotions. It's like holding up a mirror to their emotional world, helping them to better understand and process their own internal experience.
That sounds like it would be incredibly validating to feel truly seen and heard in that way.
It is.
What about immediacy?
So immediacy can be a bit tricky.
Yeah.
It's basically about the therapist sharing their own in-the-moment experience with the client when appropriate.
Okay.
And it's another way of being authentic and transparent in that relationship.
Okay. But isn't there a risk of the therapist's feelings sort of interfering with the client's process?
There's definitely a delicate balance there. The
Yeah.
key is that immediacy should always be used in service of the client's growth,
Yeah.
not to meet the therapist's needs.
Right.
For example, if a therapist notices they're feeling bored or distracted during a session,
Yeah.
they might share that observation with the client.
Okay.
And this could open up a valuable conversation about the client's level of engagement in the therapy process.
Oh, that's interesting.
Yeah,
So it's about using those moments of awareness to deepen the process, not derail it.
exactly. And by modeling this kind of vulnerability, the therapist can also encourage the client to be more open and authentic in their own self-expression.
It's like this whole approach is built on trust and this genuine back and forth between the therapist and the client.
Precisely. And that's one of the things that makes PCT so unique.
Yeah.
It's not about the therapist being the expert with all the answers.
Right.
It's about creating a collaborative relationship where the client can explore their own inner wisdom and find their own path forward.
I'm curious, though, what happens when a client is resistant to that kind of self-reflection?
That's a great question, and it's something we'll definitely explore further in the next part of our deep dive. But for now, I think it's important to remember that PCT is ultimately about empowering the client.
Right.
It's about honoring their pace and their process, even if it means encountering some bumps along the way.
So it sounds like patience is a pretty important virtue in PCT,
Absolutely.
both for the therapist and the client.
100% change doesn't happen overnight. It's a journey, not a destination. And that brings us to another key concept in PCT.
Okay.
The idea that behavior change actually takes practice.
Mm-hmm.
It's not about having some magical epiphany and suddenly becoming a new person.
Right.
Curtis actually compared it to learning a musical instrument.
Yeah.
You don't just pick up a guitar and instantly shred like a rock star, right?
No.
It takes time, dedication, and consistent effort to develop those skills. And the same goes for personal growth. It's about identifying the areas where you want to grow and then committing to the practice even when it gets tough.
So if PCT is about creating the optimal conditions for growth, does that mean the therapist is kind of like a coach cheering the client on and helping them stay motivated along the way?
That's a good way to think about it. But it's important to remember that the therapist isn't dictating what the client should be doing or how they should be changing.
Right.
It's more about providing support and encouragement as the client explores their own goals and values.
Which brings me back to this whole idea of self-acceptance preceding change.
Yeah.
What does it actually look like to practice self-acceptance in the context of PCT?
That's a really good question, and I think it's something we should dive into next time.
Okay.
But for now, I'll leave you with this thought. Imagine what it would feel like to approach yourself with the same kind of unconditional, positive regard that a PCT therapist offers their client.
Mhm.
What if you could embrace your strengths and your weaknesses, your successes and your failures with equal compassion?
That's a powerful image.
It is.
I think we've covered a lot of ground today, but there's still so much to explore.
There is.
When we come back, we'll dig deeper into the nuances of PCT, including how it addresses resistance, the role of self-acceptance, and the idea of finding that kernel of truth in even the most challenging behaviors.
I'm looking forward to it.
Yeah, me too. And in the meantime, for our listeners, if you're finding this conversation as thought-provoking as I am,
Yeah,
we would love to hear your reflections.
please.
What's resonating with you most? What questions are coming up for you? Let's keep the conversation going.
Absolutely.
All right, we'll see you next time.
Sounds good.
Welcome back to our deep dive into person-centered therapy.
Yeah.
Last time we were talking about the importance of the therapeutic relationship and the unique aspects of PCT techniques. And you left us with a really thought-provoking question.
Right.
How does a PCT therapist handle resistance in a client?
Yeah, that's a key point to address because resistance is a very natural part of the therapeutic process, especially when we're talking about self-reflection and change.
So how would a PCT therapist approach that resistance?
Well, remember, PCT is all about honoring the client's autonomy and their pace.
Right.
So instead of seeing resistance as something to be overcome or defeated, a PCT therapist would approach it with curiosity and empathy.
So they wouldn't try to force the client to open up or confront their issues head on.
No, no, not at all.
Okay.
They might explore the resistance with the client and gently inquiring about what might be causing it.
Yeah.
Perhaps the client feels unsafe or judged or simply not ready to delve into certain topics.
It sounds like it takes a lot of sensitivity and skill to navigate those waters.
It does. It requires the therapist to be truly present and attuned to the client's subtle cues.
Yeah.
The goal is to create a space where the client feels safe enough to explore their resistance at their own pace.
That makes me think about the whole idea of the therapist being a facilitator rather than a director.
Absolutely. That's a great
Yeah.
connection.
Yeah.
In PCT, the therapist is there to guide and support the client's journey of self-discovery, not to dictate the path or the destination.
And this brings us back to the concept of self-acceptance, which you mentioned last time that we dig a little deeper into.
Yes.
How does self-acceptance work in practice within the framework of PCT?
Well, imagine a world where you could approach yourself with the same kindness, compassion, and understanding that you would offer to a close friend.
Yeah.
That's the essence of self-acceptance in PCT.
It sounds so simple, but I think we all know it's a lot harder than it sounds.
It is. We tend to be our own harshest critics.
Oh, yeah.
We judge ourselves for our flaws, our mistakes, our perceived shortcomings.
For sure.
But PCT suggests that true growth and change can only blossom from a foundation of radical self-acceptance.
So it's not about ignoring our weaknesses or pretending they don't exist.
No, not at all.
Okay.
It's about acknowledging the full spectrum of who we are, the good, the bad, and everything in between, and embracing ourselves wholeheartedly.
I love that. So how does that play out in the therapy room?
The therapist might help the client explore their self-critical thoughts and beliefs,
Okay.
gently challenging those that are unhelpful or distorted. They might also encourage the client to practice self-compassion, treating themselves with the same kindness and understanding they would offer to a loved one.
So it's about shifting from a mindset of self-criticism to one of self-compassion.
Exactly, and this shift can be incredibly empowering.
Yeah.
When we learn to accept ourselves fully flaws and all we create a space for genuine growth and change.
It makes me think about Curtis's analogy of the tree reaching for sunlight.
Yes.
If we're constantly criticizing ourselves and focusing on our perceived shortcomings, it's like we're blocking the sunlight from reaching our own potential.
That's a beautiful analogy. I love that.
Yeah.
Self-acceptance is about removing those internal barriers and allowing ourselves to flourish.
Speaking of removing barriers, one of the things that struck me about PCT is this emphasis on seeing the good in clients, even when they've made mistakes or engaged in harmful behaviors.
Right.
How does that work without condoning or minimizing those actions?
That's where Marsha Lanham's idea of the kernel of truth comes in.
Okay, the kernel of truth.
Remember, PCT is about understanding the underlying needs and motivations that drive behavior, even those that might appear negative or destructive.
So it's about recognizing that even the most challenging behaviors often stem from a place of pain or unmet needs.
Exactly. And by approaching the client with empathy and curiosity, the therapist can help them explore those underlying needs and develop healthier ways of meeting them.
Curtis gave the example of someone slashing tires.
Right.
Obviously a destructive and unacceptable behavior.
Of course.
But he suggested that the therapist might acknowledge the anger behind it while also exploring more constructive ways to express that anger.
That's a perfect example of finding the kernel of truth in a challenging behavior.
Yeah.
It's not about condoning the tire slashing, but rather understanding the intense emotions driving it. And once those emotions are acknowledged and validated, the client can begin to explore healthier and more effective ways of coping.
So it's about addressing the root cause rather than just the surface symptom.
Exactly. And this approach can be transformative, especially for clients who have been judged or condemned for their actions.
Yeah.
It allows them to feel seen, understood, and worthy of compassion, even when they've made mistakes.
This all ties back to the core principles of PCT empathy, unconditional positive regard, and the belief in the client's inherent capacity for growth.
Absolutely. These principles create a safe and supportive space where clients can explore their inner world, confront their challenges, and ultimately embrace their full potential.
It sounds incredibly empowering, but I have to admit, as we're talking about all of this, I keep thinking this all sounds great in theory.
Yeah.
But how does it actually work in practice?
Yeah.
What does a PCT session actually look like?
That's a great question, and one we'll unpack in the next part of our deep dive. We'll explore some specific examples of how PCT techniques are used in session, and we'll also consider how the principles of PCT can be applied not only to therapy, but to other areas of life as well.
I'm really looking forward to that.
Me too.
And for our listeners, if you're finding this conversation as thought-provoking as I am,
Yeah.
we'd love to hear your reflections. What's resonating with you most? What questions are coming up for you? Let's continue the dialogue.
Absolutely.
Welcome back. We've been talking about all these person-centered therapy concepts,
Right.
but I'm really curious to see how this actually plays out in a therapy session.
Yeah, it's easy to get lost in the concepts, but seeing it in action really brings it to life.
For sure. So what might a typical PCT session look like?
Well, first of all, there's no script.
Oh.
Each session is unique and guided by the client's needs and what they bring to the table that day.
Yeah.
But you'll definitely see those key elements that we've been discussing woven throughout.
Like empathy, unconditional, positive regard, congruence.
Exactly.
Gotcha. Can you give me like a specific example?
Sure. So let's say a client comes in and they're feeling really anxious about a presentation they have to give at work.
Okay.
Now, in a more traditional therapy setting, the focus might be on, developing coping mechanisms or practicing relaxation techniques.
Right.
But in PCT, the therapist might just start by acknowledging and validating those feelings of anxiety.
Right.
They might say something like, it sounds like you're feeling really overwhelmed and stressed about this presentation. That's understandable.
Yeah, so it's about creating that safe space for the client to express their emotions without judgment.
Exactly. And from there, the therapist might use active listening and reflection of feelings to help the client explore those feelings a little deeper. They might ask questions like, what are some of the specific thoughts that are causing you to feel anxious? What's the worst case scenario you're imagining?
Would the therapist offer advice or solutions in that scenario?
Not in the traditional sense.
Okay.
Remember, PCT is about empowering the client to find their own solutions.
Right.
The therapist might gently guide the conversation,
Yeah.
helping the client to identify their own strengths and resources,
Okay.
but they wouldn't impose their own opinions or beliefs.
So how does change actually happen in this type of setting? If the therapist isn't providing direct advice, what's the catalyst for growth?
It's a fascinating process.
Yeah.
By feeling truly heard and understood, by having their feelings validated and reflected back to them, clients often start to gain new insights into their own experience.
Okay.
They might start to challenge those negative thought patterns, explore alternative perspectives, or even come up with their own solutions.
So PCT is really tapping into the client's own inner wisdom and capacity for healing.
Precisely. And that's what makes it so powerful.
Yeah.
It's not about the therapist fixing the client.
Right.
It's about creating the conditions where the client can heal and grow from within.
It's almost like the therapist is holding up a mirror, helping the client to see themselves more clearly and to connect with their own inner strength.
Yeah, that's a great way to put it. And as the client gains more self-awareness and self-acceptance, they naturally start to make choices that are more aligned with their true values and goals.
We've been focusing on the therapy setting,
Right.
but it seems like these principles could be applied to other areas of life as well.
Absolutely. The core principles of PCT empathy, unconditional positive regard, congruence, can be incredibly valuable in any relationship.
Yeah.
Think about your interactions with your partner, your friends, your family members. Imagine approaching those relationships with a genuine desire to understand, to listen without judgment, and to be authentically yourself.
It sounds like that would require a real shift in mindset.
It does. It's about letting go of the need to be right, to control, or to fix others.
Yeah.
It's about meeting people where they're at and creating a space for genuine connection and growth.
It makes me think about parenting.
Yeah.
What if we could approach our children with that same kind of unconditional positive regard?
That's a powerful idea. Imagine a world where children felt truly seen, heard, and accepted for who they are rather than who we want them to be.
It would certainly revolutionize the way we raise the next generation.
It really would.
And who knows, maybe it could even lead to a more compassionate and understanding world overall.
I think so too.
Well, I think we've given our listeners a lot to think about today.
We have.
We explored the core principles of person-centered therapy. We've seen how it plays out in practice.
Right.
And we've even considered how we might apply these principles to our own lives and relationships.
And if any of these ideas resonated with you, I really encourage you to explore further.
Yeah.
Do your own research, and maybe even consider experiencing PCT firsthand.
That's great advice. And if you have any reflections or questions about what we talked about today, please leave a comment below, and let's continue the conversation.
Yeah, let's keep talking about it.
Thanks for joining us for this deep dive into the world of person-centered therapy.
It's been great talking with you about it.
All right, we'll see you next time.
See you later.